The human heart beats more than 100,000 times a day, but for nearly 5 million Americans, the heart can suddenly start racing or beat unevenly. That's caused by a condition called atrial fibrillation or A-Fib.
Yeah, so atrial fibrillation is a heart rhythm disorder where the top chambers of the heart beat in a chaotic, disorganized fashion. It can cause the blood flow to stagnate in the top chamber of the heart, which puts you at risk for a stroke. In addition, it can cause the bottom chambers to race in a rapid and irregular fashion.
I was at home sick with a terrible cold, and I noticed that immediately after taking some antibiotic that my heart began racing, and I thought, this is beyond racing. As a matter of fact, I can't even distinguish a beat.
For many patients like Mark Bird, symptoms of A-Fib come on unexpectedly.
Happened again about 5 years later, again with another cold.
Doctors diagnose A-Fib by using an EKG or heart monitors because sometimes patients can confuse symptoms with other heart conditions.
One of the big symptoms that people often feel is palpitations, which is just the sensation of the heart beating either rapidly or irregularly. People can also feel short of breath, dizzy, lightheaded, tired, fatigued, a general lack of energy, and occasionally people don't have much in the way of symptoms, although that's probably a little less common.
And if left untreated, doctors say A-Fib can lead to blood clots, stroke, and even heart failure.
Well, it was depressing. I mean, it was not anything I'd ever want to hear.
Mr. Bird said he's generally very healthy and active, even taking up painting artwork across the world. So when Dr. Kent Morris with Norton Heart Specialists said surgery was ahead, Mr. Bird said he wasn't so sure.
But it's a little unnerving knowing that you're going to take a person who is physically feeling fine and push them off the cliff only to save them before they hit the bottom. That's how I felt.
And it involves putting IV tubes into the veins in the leg, putting catheters through those up to the heart. We go across the middle part of the heart and we cauterize around areas on the left side of the heart where atrial fibrillation comes from, the idea being that we're going to prevent the A-Fib from coming back.
Dr. Morris says Mr. Bird tried medication first to avoid the ablation procedure, but in his case, surgery was the best option.
Most people we will try on medications first. Some people do well on medication for a long time, even years. But if the risk factors for atrial fibrillation are not treated, or in some people, just the atrial fib progresses to the point that the medication is no longer effective. And for those people, ablation may be a good option to help treat their A-Fib.
Dr. Morris said addressing risk factors for A-Fib before treatment is also important.
Really, it is critically important to address all of those risk factors when you're treating someone with atrial fibrillation. It's not we're just going to give you a pill or we're going to do a procedure that's going to fix you. You really have to address the whole picture and address all of those issues.
A-Fib symptoms can return in some patients, so Mr. Bird keeps a special pill in his pocket just in case.
It's to avert A-Fib should you ever recur, those symptoms ever recur. So, yes, luckily those pills are old and powdery almost.
So in people that have a healthy, otherwise normal heart like Mr. Bird, there are a couple of medications that we can use to treat A-Fib if it only happens every once in a while. So in other words, rather than giving a pill someone once or twice a day for an episode that maybe happens once a year, they would have a pill that they would carry around, and they would only take it if that episode occurs.
For the most part, Mr. Bird says he's worry-free and already planning his next trip to capture the world on canvas.
I don't know if I'm out of the woods, but I certainly feel like maybe the darkest part is behind me. Do not put this off. You owe it to yourself to give yourself the benefit of the doubt to go through with this procedure. it can mean the difference between hiding from your life and living your life.